Hey guys, this is my documentary on my experience of going through prostate cancer and recovery. And the reason why I'm doing this is because I want you guys out there who maybe have prostate cancer, just got diagnosed, or they're gonna go through surgery, or wondering what to expect. And I'm gonna kind of try to help ease those concerns and answer those questions for you through my own experience. I was diagnosed with prostate cancer on December 7th, 2010. And the first thing that I remember thinking about were some of the friends that I needed to talk to. I was in shock. First I thought it was a joke, and I was certainly hoping that he had just my doctor had a really poor sense of humor. He didn't, and he was just as surprised as I was that I had it, because I'm 43 years old. And typically men older than me have it, but that's the dice. I asked him why did I get it? What did I do wrong? Have I been treating myself, too much stress or whatever? And he says it's all genes. I think there's probably a stress element there, but I'm not an expert. All I know is that I know what I did through life, and I know I stressed out a lot. I know that I didn't treat myself emotionally as well as I probably should have. And now I'm sitting here at 43 years old with prostate cancer. So they can think what they want, and they can tell people what they want. I think there's probably more to it than just genes. What you can expect when you're diagnosed with prostate cancer, I don't think I really have to tell you guys about. If you're looking at this, you've already been diagnosed. Maybe you're thinking you do, maybe you're worried about it. Get a biopsy. I went in with abdominal problems in my lower pelvis area. That's what kind of got me thinking I need to see a doctor. I had those pains for about a year. Went in, they thought, well, maybe your prostate's infected. So they gave me, over the course of 2 different times, I probably got about 90 days worth of antibiotics, and it didn't change. So my doctor said, well, you're 43, I've never diagnosed anybody at that age with prostate cancer. I don't think you got it. You don't have any of the signs of having cancer. But let's do a biopsy of your prostate. That was back in August. Well, I didn't take it seriously, and I waited till November to go in for that biopsy, and it came back positive. So that was pretty stupid. It could have made the difference between whether it spread or not. It didn't spread, so what I ended up with was knowledge of a localized infection of cancer in my prostate. And the treatment for that is, actually I also had some cancer in my lymph nodes down in that area. So the answer to that is to have it removed, and there's a couple of techniques that they talk about and have it removed. One is orthoscopic surgery, and one is open hand. You go in, you make a big incision. Doctor goes in there, has a full field of view of everything, and he cuts the sucker out. For my situation, it was a little easier of a decision between going orthoscopic with a robotic or open hand, because I had these lymph nodes that were infected. The orthoscopic won't go in. They can't get those lymph nodes when they do that. So it was a pretty easy decision for me. Also, supposedly the open hand techniques have a better success rate on not damaging the nerves that cause erections. So the problem with open hand, it's about another 2 to 3 week recovery period. So let me see, better chance of having erections later, and I gotta go through recovery for 2 more weeks. It's an easy choice. So after that, I had the bone scan. The best place for prostate cancer to spread to is the spine. So we had a bone scan that came back clear. We did a CAT scan. It came back clear, so it was just localized. At that point in time, my doctor says, you need to start thinking about a surgeon to do this, and you need to start thinking about when. He felt that I could probably wait about a month and a half, 2 months max, without it spreading. Prostate cancer is a very slow spreading disease. So luckily it was just localized. Good news. So anyways, I went through the holidays, and I wanted to see my family and visit and have that last holiday before I had to go in under the knife. And I started realizing I was putting it off. And finally, my work basically said, don't come back after the 14th of January until this is done. And I needed to have it done, I knew, but that kind of helped. I had a couple buddies who had researched prostate cancer on their own for other reasons, their own reasons, and a lot of the answers I needed were validated from what they came back with as well. And so I decided to have it done on the 17th. I got to tell you, the time between when I was diagnosed and the time when I got it, I got the surgery done, that it was there's a big load on my mind from that. And I would recommend the sooner you can get it done, the better. There's holidays and things to consider, but the sooner you can get it done, the better. I really do think that. One of the things that is important to remind yourself regarding surgery is, even though there's risks to erection issues, there's risks to incontinence issues. Thing is you can live with those things because you're going to live if you get that prostate out. So taking the prostate out, there's a risk you're going to have problems, but it's taking the risk of losing your life because of the disease away. So it's worth it up to the point when you have the surgery. Try to keep that in mind. I had a hard time doing that. I kept forgetting that I'm saving my life with the surgery and kept thinking more about, I'm not going to be able to get a hard-on anymore, or I'm going to wet my pants every once in a while. What the hell? Those are things that can happen, but there's ways around that kind of stuff. My urologist keeps saying, listen, you're going to live through this cancer thing. You're going to get the surgery, and if you have a problem with erection, I'll show you how to figure that one out. Don't worry about that. You'll get one. But you're going to be able to be around to get one. So get your head straight on the surgery. If you're like me, get your head straight. You're saving your life, and continue to keep that as the foremost in your mind regarding having the surgery, or you'll dread having it. I'm going to log off for now, and I'm going to give you guys, through these different little video vignettes, an idea of what I went through and how you can prepare for it. There's some things you should be doing before the surgery that are going to make your recovery a lot easier. And so go through these vignettes, and I'll show you some of these, how to prep the supplies, how to get your body in shape. Very important, some things about your body that you want to start working on that are going to help support you a lot more through your recovery. So I'll talk to you guys soon.